Hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Hallie Leinhart, and I'll be your host today. Our webinar today is on navigating disability benefits, new research on administrative burden and work incentives. Programs like SSI and SSDI help millions of U.S. residents through monthly support that is especially critical for low-income and aging people with a disability. Research shows that current and prospective beneficiaries may struggle to navigate the application process and eligibility requirements. Our panelists will present and discuss research on administrative burden in accessing SSA program benefits, as well as participation and barriers to employment. We're very pleased to welcome three distinguished panelists today. First, we'll hear from Dr. Ramonia Rochester, who is the Research Director at National Disability Institute. She'll provide an overview covering core concepts of disability benefits and current policy and practice issues. Ramonia, thanks for joining us today. Next, we'll turn to Dr. Debra Brucker, who is a research professor with the Institute on Disability at the University of New Hampshire. She will present on the administrative burden experienced by U.S. rural residents accessing Social Security Administration benefit programs in 2024. Deb, great to have you with us. And finally, we'll hear from Dr. Mike Levere, who is an assistant professor of economics at Colgate University. He will share his research, can changes in disability insurance, work incentives, influence beneficiary employment? Evidence from the Promoting Opportunity demonstration. Mike, we're so glad you could join us today as well. Please note that views expressed by our speakers don't necessarily represent the opinions or policies of the Institute for Research on Poverty or of any other sponsor, including the University of Wisconsin-Madison. We have an hour today, and after we hear from our presenters, we'll spend the last 15 minutes or so for a live Q&A session. You can type your questions in the Q&A box throughout the webinar. We did get quite a few questions submitted as people registered, so we will be queuing some of those up as well. I hope you'll also feel free to participate through the chat. We would love to know who you are and where you are joining us from. And I also want to let you know that we have closed captions enabled, so you can toggle those on and off at the bottom of your screen. We will be posting the recording of the webinar within a day or so, and you'll receive a link to those by email. So with that, I'm very pleased to turn it over to Ramonia Rochester.
Thank you so much, Holly, and welcome everyone. Please let me know if you are seeing the presentation.
Not in the presentation mode. I got something useful. Yeah, there you go.
Perfect.
Perfect, thank you. As Holly mentioned, I am the Director of Research at National Disability Institute, and I'm Ramonia Rochester. And for those of you who may not know, NDI, or National Disability Institute, is the first national organization committed exclusively to championing economic empowerment, financial education, asset development, and financial stability for all persons with disabilities. And we've been doing that for the past 19 years. Through our programs, we build capacity for the field through training and technical assistance. We help create systems change by implementing models that can be replicated. We test innovative approaches to financial empowerment, and we lead research to uncover barriers and opportunities for people with disabilities. And of course, as do you all, we do this based on the promise of the American with Disabilities Act, which states that the nation's proper goals regarding individuals with disabilities are to assure equality of opportunity, full participation, independent living, and economic self-sufficiency for all individuals. So let's start with the basics. Disability. According to the Social Security Administration, in order to be eligible for benefits, an applicant must be disabled based on a medically determinable physical or mental impairment that has lasted or is expected to last for at least 12 months or will result in death. For those who wish to be employed or those who will receive benefits in the first place, there is a substantial gainful activity threshold or an income limit which you cannot exceed in order to receive disability benefits. This threshold changes every year, and for 2025, it is $1,620 per month for non-blind individuals and $2,700 per month for blind individuals. The two programs that we're going to be focusing on today are the Supplemental Security Income Program, which is SSI, and the Social Security Disability Insurance Program, which is SSDI. SSI is a cash benefit program which assists low-income individuals, including adults and children who are blind or disabled, in addition to adults 65 years and over. As I said before, both these programs have limits or requirements, and the income limit for the SSI program stipulates that for wages, you must not exceed $1,620. Now, that's a tiny amount. In addition to that, all income and wages are counted with a few exclusions. For the first $20 more in income you receive every month, that is excluded. And then subsequent to that, the first $65 of earnings, and then half of earnings exceeding $65 received each month. For the Social Security Disability Insurance Program, or the SSDI program, this is also a cash benefit, but this requires that you have a work history, that you would have earned Social Security credits and paid into federal insurance through FICA taxes or the Federal Insurance Contributions Act taxes, and payments vary based on age, earnings, and who is receiving those payments. Now, the SSDI program has no resource limits. However, the SSI program says you cannot exceed $2,000 in individual resources for individuals and $3,000 for couples. These resources include cash, bank accounts, stocks, bonds, and property, excluding a primary residence, in most cases, one vehicle, and any household goods or life insurance policies that value under $1,500. And our panelists later will discuss why these issues are problematic. For those who wish to work, the Social Security Administration provides work incentives. SSA work incentives benefit people or help to keep millions of Americans out of poverty. SSA work incentives are special rules that allow individuals receiving disability benefits such as SSI, SSDI, to work while receiving monthly payments and/or Medicare or Medicaid. Beneficiaries also have access to individualized support services, and I'll share with you some of them later. Now, this is based on the work incentive legislation, or the Ticket to Work and Work Incentives Improvement Act of 1999. This legislation addresses the fear of losing income, which is a primal fear for most individuals with disabilities. It also addresses the fear of losing health insurance and encourages people with disabilities to test their ability to work while earning benefits, and this empowers them to pursue greater financial independence. Both programs offer work incentives. The trial work period is an SSDI only work incentive, but this allows SSDI recipients to test their ability to work for at least 9 months. Now, during this trial work period, they receive their full benefits, regardless of how much they earn. Beyond that initial trial work period, there is an extended period of eligibility, and this period lasts for 36 months. At the end of the trial work period, the extended period of eligibility, EPE, begins, and this allows beneficiaries to remain on the program if they earn above SGA, which is substantial gainful activity. During EPE, beneficiaries do not receive benefits in the months that they earn above SGA. However, they receive their full benefit in any month that they do not exceed those thresholds. Beneficiaries who exhaust EPE can continue to earn above SGA, or who exhaust EPE and continue to earn above SGA are terminated from the program. There's also expedited reinstatement, which in a case where your benefits would have stopped because you exceeded the earnings level, but for some reason you are no longer able to work, whether because of a medical condition or one related to it, you can request to have those benefits reinstated without having to complete a new application. While Social Security determines your benefits reinstatement, you are also eligible to receive temporary benefits for up to 6 months. And then there's the protection from medical continuing disability reviews. If you assign your ticket, which we'll talk about a little bit later, to an approved service provider, you automatically receive notice of continuing disability review, which you will not need to undergo while participating in the Ticket to Work program and as you make progress within stipulated Social Security timeframes. There's also the blind work expenses work incentive. Under BWE rules, Social Security can subtract the cost of any reasonable expense that you need for work from your earnings, including taxes, when deciding if you are eligible for SSI payments. And that is an SSI only incentive. There's also the unsuccessful work attempts incentive. UWA is an effort to do work in employment or self-employment, which may have stopped or reduced below substantial gainful activity level after a short time, say 6 months or less. This was because of your impairment. If this was because of your impairment or the removal of any special conditions related to that impairment that you need to help you work, then UWA will kick in. This allows these earnings not to be counted against SGA or substantial gainful activity decisions in determining whether you will continue to receive benefits or not. And then there is PASS, the Plan to Achieve Self-Support. This allows you to set aside other income besides supplemental security income or SSI and resources for a specified period. This allows you to pursue a work goal that will reduce or eliminate the SSI or SSDI benefits you receive ultimately. And you can set aside money to pay expenses for education, vocational training, assistive tech, and other areas. Income that is set aside does not count toward your SSI payment amount. Now, work incentive programs and services are offered through various agencies and local organizations. As I mentioned before, the Social Security Administration offers the Ticket to Work or the Ticket program. They also offer work incentives planning assistance through community-based projects. The U.S. Department of Labor offers the Workforce Innovation and Opportunity Act programs. U.S. Department of Education Rehabilitation Services Administration, RSA, offers programs and services through the state vocational rehab agencies, and state and local governments also offer workforce development boards and American Job Center as resources and state and local economic development agencies that partner with business to provide incentives and other supports. Additionally, there are employer assistance programs that are offered by employers as they see fit. Nonprofit and community-based organizations operate and offer services through employment networks or ENs, centers for independent living, foundations, and other disability advocacy groups, Service Source, and other work incentive planning providers. The Ticket to Work program is one of the flagship programs that offers work incentives to individuals with disabilities. Social Security disability beneficiaries ages 18 through 64 are allowed to keep their cash benefits, as well as Medicaid or Medicare as they transition to work. They also receive individualized assistance from employment service providers through employment networks or state vocational rehabilitation agencies. As I mentioned before, they are able to forego the continuing disability review, and they have the option to return to benefits if unable to continue working. The Ticket program offers all of these protections. The American Dream Employment Network is NDI's administrative EN, which is a consortium of service providers and employers working together to assist SSA beneficiaries with disabilities begin to work or return to work. There are ENs nationally. WIPA, or Work Incentives Planning and Assistance Programs, as I said, are projects by community-based organizations that are funded by the SSA. They provide free benefits counseling and information about work and benefits to SSI and SSDI beneficiaries. They also provide counseling support through certified community work incentive coordinators, and they serve beneficiaries who are already working, who are about to start working, or who have a pending job offer or are interviewing for a job. They also serve transition age youth between ages 14 through 25 and veterans. My colleagues will talk a little bit later about the impact of administrative burdens. But just to introduce some of these issues, an administrative burden is defined as any difficulty that makes it challenging for individuals to access, navigate, or maintain social services and assistance for which they are likely eligible. These burdens can include complex, confusing application processes, lengthy, complicated, or otherwise inaccessible paperwork, asset tests, backlogs, long wait times for reviews and appeals, inaccessible and poorly designed digital resources such as websites. Administrative burdens have myriad costs for beneficiaries. There are learning costs, which include the difficulty understanding complex program rules, the eligibility criteria, as well as the application processes. There are psychological costs, which include the stress, the stigma, and the frustration of navigating these programs, and the impact that all of that has on mental and physical health. There are compliance costs, the time and resources spent completing applications, documenting and meeting ongoing eligibility requirements, and of course, also the financial costs associated with such things as overpayments. Administrative burdens have greater impact on people with worse medical conditions, lower prior earnings, and lower levels of education. Application and documentation requirements are extensive for SSA programs. Eligibility redeterminations are often laborious, and evaluation and reporting requirements lead to fewer being eligible. Legal expertise are also in short supply, and the appeal process for disability insurance decisions are out of reach for many. One of the areas or issues that exacerbate these administrative burdens is the SSA resource shortages that have been persisting. Over the past 14 years, there has been a 19% decrease in the customer service budget for the SSA. This is despite a 20% decrease in staff, which in just 2025 alone, 13% of the workforce has been laid off. And this despite a 28% increase in the number of beneficiaries who need services and support from the system. There are also administrative burdens related to child SSA eligibility. My colleagues will talk about the low uptake in that area, but complex eligibility rules, such as the definition of disability for children, lack of information and outreach, including limited access to technology or community resources, and a lack of awareness overall of how the SSI program benefits children, as well as application process burdens, which is the overwhelming requirements for extensive documentation, medical records, and a detailed understanding of the SSA's requirements are also administrative burdens. The medical documentation in particular is burdensome for families with children who would otherwise be eligible for SSI. Medical evidence to prove the severity of the child's condition can be a significant hurdle, especially for conditions not listed in the SSA's childhood listings of impairment. There are also several policy impacts, including those related to work disincentives. The cash cliff is a major disincentive. The size of the offset in disincentives to work relative to current SSA rules and other factors. The gaps between benefit changes and people's ability to earn lead to overpayments. The costs incurred by work in addition to losing benefits often outweigh the income beneficiaries receive from work. These all are disincentives for beneficiaries, people with disabilities, to join the labor force. The cash cliff in particular is related to how interconnected programs and multiple sources of public assistance impose these income thresholds cumulatively, which result in a sudden loss of one or more, or can result in a sudden loss of one or more benefits if these thresholds are exceeded by at least or even $1. This, of course, provides a financial disincentive where losing multiple benefits and the increased cost of working is not worth losing those benefits. And of course, ultimately, this leads to disparate outcomes for individuals with disabilities. Administrative burdens, disparities in rural access, low uptake of SSI for families with eligible children, and other policies that create work disincentives result in overall fewer positive outcomes for people with disability. Lack of access to long-term positive health, education, and financial outcomes, higher rates of poverty among people with disability, and lower levels of employment and financial independence are the unfortunate result. At this time, I'll turn over to my colleague who will take us further into these issues.
Thank you, Ramonia. That was a great context that you set for us. I wanted to share some information about the administrative burden experienced by rural residents accessing Social Security Administration benefit programs, including retirement benefits. This was work conducted with my colleagues Stacia Bach, Megan Henley, Andrew Houghtonville, and Kelly Nye Lingerman. A portion of the research that I'm talking about was funded by the Social Security Administration, and I want to be clear that the views expressed are solely those of the authors and don't represent the views of SSA, any other agency at the federal government, or the University of New Hampshire. So in our study, we aim to use a community-engaged approach to understand the administrative burden of applying for and/or receiving Social Security Administration disability, retirement, or survivor benefits experienced by rural adults with disabilities, family members of adults of people with disabilities, and older adults. And Ramonia had defined administrative burden for our project. We talk about the learning costs, the compliance costs, and the psychological costs, similar to what Ramonia mentioned of administrative burden. And so this study was conducted in New Hampshire in the summer and fall of 2024. Just to understand New Hampshire, we are a very small state of 1.4 million residents. 7 of its 10 counties are rural. 3 of the rural counties had SSA field office, which means that 4 of the 7 did not. And the motto for New Hampshire is live free or die. So there's a strong bent towards being independent in New Hampshire. And the community engaged, we had community advisors. So think of that as sort of a advisory group, a dozen people with lived experience who played an advisory role in different parts of our project. And then we also talked to community members, which were people with lived experience who were research participants. And we talked to 40 people in total. Our process was to first gather input from the community advisors about our research questions, our focus group protocol, recruitment strategies, then collect data from our community members, then check back in with the community advisors for feedback on our preliminary findings. Then we finalize our research findings, incorporating the advisor input, and we also solicited help from the community advisors in sharing our results. So as I mentioned, the data collection occurred in summer and fall of 2024, and some of these pictures you'll see are from our road trips we took to get to the most rural parts of New Hampshire. We conducted 5 in-person focus groups. These occurred at 2 senior centers, 1 UNH extension office that was a disability advocacy group's location that they were meeting at, 1 federally subsidized older adult disabled persons rental complex, and 1 was at a peer behavioral health network office. We also conducted 2 virtual focus groups and 3 interviews. This slide shows the characteristics of our participants. Most were older, most were female, most were white. Most had only a high school education, so about half of them. Most stated that they had a disability. So remember, this is a group that includes older adults as well as younger people who had a disability. And in terms of counties, 16 of the 40 people we talked to resided in counties without a field office. So that gave us a unique perspective. We had people who were living in a rural county that had a Social Security field office, as well as a number of people that were living in rural counties that did not have a Social Security field office. In terms of key themes, we kind of group these into 4 areas, and I'll go through each one and provide some quotes and context. So the first theme relates to applying for and maintaining benefits. First, we found that people seeking retirement or survivor benefits had the lowest levels of administrative burden. That doesn't mean they had no administrative burden, but they had the lowest levels of the people we spoke to, and they really did not share that they experienced any psychological stigma in terms of applying for retirement benefits. We heard from one person highlighted here who was stating how helpful their employer actually was in telling them what to do to apply for retirement benefits. And as I mentioned, for the most part, people found that to be very straightforward. People applying for SSA disability benefits faced much higher learning, compliance, and psychological costs. They relied on formal and informal networks for information assistance. In terms of formal networks, lawyers and caseworkers, and informal, they had families or friends that were helping them. As an example of learning and compliance costs, we heard from people, as highlighted here. One person said, I did look into Social Security for disability benefits, but like another participant said, the red tape and paperwork was too overwhelming and I didn't get very far, and that person just gave up in terms of applying for disability benefits. Another person who shared that she had been hospitalized 3 times for a mental health condition over the span of a decade, did not realize that she could get disability benefits for mental health. She stated, I didn't know that I could get it for mental health. I thought I had to have a physical disability or be retired. And it was only a doctor on her 3rd admission who brought up the idea that she could consider applying for disability benefits. And then in terms of psychological costs, we heard from several people that shared they felt some stigma in terms of applying for disability benefits, either internally or from their family members. One person stated, I still have a problem talking about disability or me being on disability because I've been working since I was 15. Next, we'll turn to SSA customer service. Most people that we spoke with, when they were able to access in SSA field office in person, were satisfied with the service that they received there. One person stated, I would say we're lucky in the town because we have an office right here, very convenient. People who don't have an office in their town have to travel. But we did hear from people talking about variations in accessibility, about the process overall, about the mail that they received, and about the actual field offices. So one person who had some physical limitations said that from the beginning of the process, there was a lot of paperwork, which they found overwhelming because they couldn't use their hands, and everything is online now. So they had to have someone do the paperwork for them, which they found overwhelming, long and tedious, and it caused some anxiety. So that was very challenging. As a second example, someone stated in terms of mail, for someone that can't see very well, to know what they're supposed to do to rip the 2 sides and pop off to get the benefit information for tax returns was one example of a challenge. And a third example, one person who had light sensitivity stated that going into the field office can be difficult because it's way too bright. Next, in terms of SSA customer service for people that were trying to access a field office, and as I mentioned, we talked to a number of people that did not have a field office within their county. Travel was a big concern. People stated that there should be more offices. It's too far. We had an example as shown here, someone saying that was about 1 hour and 40 minutes. Some people did not have access to cars. This top example is a person who said, me personally, I'm homeless, living in my car, so it's real hard since you're using gas money just to heat up the car, and that takes away from going to Social Security if they need to. As a second example, someone who's not able to drive but they have a car would need their wife to drive them, and she has a full-time job, so she would have to take off of work to be there at a certain time. And then there's often a wait, and it can take all day, so she needs to take time off. And so potentially they would be losing income to actually go to a field office. And then we heard a lot of mixed reviews about phone and mail service. People had issues understanding information they received through the mail. As one person's, and sometimes this caused people to actually go to the field office. So if they received something they didn't understand, they went to the field office to have someone try to explain it to them. Another person not included on this slide mentioned the short time frame between when they would receive something in the mail and when they were supposed to take action on it, and that they couldn't necessarily juggle their work schedule or otherwise to get to a field office within that time frame. In terms of phone, we heard People were not happy for the most part with the phone service. People stated that the customer service is horrible, that the calls they felt were not getting to the Social Security Administration, that they would call the 800 number, and for some reason that information didn't seem to be collected on the computers of the people that were working at SSA, and then they would call again, and the person would not be able to find any information that they had called previously. So they found that very stressful and a high level of burden. Our third theme relates to technology experience. So in general, people struggled with access to technology as well as the ability to use technology. As one person stated, so elderly folks up here, many of them don't have computers and they could only get computer access at the local library, but they don't know how to use computers. So even if they could access computers at the local library, they wouldn't know what to do once they got to a computer. Other people had smartphones, but they said they didn't really know how to use them to full capacity other than to get phone calls. And others stated that even though they had smartphones, it doesn't mean they had enough money for data to do things that required work over the internet. We asked about the SSA website. Most people who had looked at the website thought that it hadn't worked out very well to get through it. It was very confusing, and they didn't find it very helpful in shortening or improving the way they were able to access the information that they needed. So given all that, we asked these participants, these 40 people, what their recommendations would be for SSA and for the community as well. One thought that some people had was that maybe Social Security should have an internal advocate or someone who helps people and perhaps comes to people's homes to walk them through the process, so that they wouldn't have to hire a lawyer, and that they felt like it was someone that would be on their side who can hold their hand through the process. We heard from several people that were they realized that people who hired lawyers had greater success in getting benefits, but they also expressed concerns about having to pay for that. They didn't think that that was something that they would want to do or would have to need to do to be able to access benefits. Other people shared that they thought the benefits were too low. One person stated that everybody on disability will end up wanting to be dead because you can't go buy groceries. You can't do anything on disability because once you pay your rent, your gas, everything else you're doing, you're broke. And another person stated, yeah, I don't know how anyone with a family can live on disability. At a community level, people suggested increasing community level non-SSA services that could help them access these benefits. But it's important to note, particularly post-COVID, that many of these nonprofits are understaffed, particularly in these rural areas that we went to in New Hampshire. As one example, someone was talking about home health aid workers, and in general, how there are less services in rural areas. And they told us that they have home health in their area, but they don't have any workers. So you can qualify for state independent living services, but there's no one working for those people. So even though you qualify, you don't, as they said it, because there's a lack of staff to keep these services working at full capacity. Another example, we talked to a number of people who were unhoused, and they mentioned one idea was to consider to allow them to pick up their mail at the field office. They don't have an address, and they stated it's not that easy. If Social Security says, oh, you don't have a physical address or you don't have a mailbox, we're not giving you your money right now, because then I'm not going to be able to live. Another person mentioned the high cost of post office boxes, which could be a workaround for not having a physical address. But a person stated if you need to get that check through the mail, then you have to rely on your family members or a P.O. box. But P.O. boxes are not cheap, because I used to do that too. It's $166 for a year. Yeah, I just can't afford that just to get mail. So we have more detail, and I'll share information about the paper that this is all written up in before, but for the sake of time, just to place this all in the current context. So this was summer, fall 2024. As Ramonia mentioned, we're in a different phase now in summer 2025 with cuts to SSA staffing, including 3,000 fewer field office staff, likely cuts to other social services that support these populations. So the implications for our findings, I would say in general, are that SSA and other agencies could engage with consumers as they're reorganizing how they're providing services, and thinking about new ways to provide services. They could provide also more individualized, accessible services, including services specific to meeting the needs of people who are unhoused. They could consider increasing benefit amounts, increasing other community level supports to assist people with SSA related tasks. So the paper, as I mentioned, that includes all this, you can access at a link that's provided here, and I believe the slides will be shared after. So I will turn this over to Mike at this point.
Thank you so much. Oh no, here we go. All right, so I'm going to still talk about administrative burden, but in the context of work activity. And this is going to be summarizing a recent paper that was published in the Journal of Public Economics, and you can go find it there. So kind of a key fact is that work activity is extremely limited among SSDI beneficiaries. Very few people work enough to exit benefits. And I was looking back at a statistic that I actually had in an earlier working paper that something like 1.5% of SSDI beneficiaries have benefits suspended or terminated due to work in a given year. And so the key question is why? Kind of big picture answer is, maybe people have disabilities that are severe enough that they can't work. As Ramonia set up, the definition of disability is that you have to have the limited capacity to engage in substantial gainful activity or to work. So if the definition of disability is related to work, then probably people are going to have disabilities that make it really hard for them to work. But at the same time, there is some really good research showing that there is, at least on the margin, some lingering capacity to be able to work, and that receipt of SSDI does reduce work activity for some people. And so that's created this big policy interest, especially from the Social Security Administration, around, what can we do to promote work? Like, are there people who deliberately don't work to avoid losing benefits? Do the work rules specifically disincentivize work potentially? And there's been a number of Social Security demonstrations over the years that have looked into this, the benefit offset national demonstration, Ticket to Work, and so on, that are trying to get at this question. So what we are going to do, what I'm studying, is the promoting opportunity demonstration. And the goal of this was to try to simplify the rules and increase the incentive for people to work. So on the right side of the screen here, what you can see is that how current rules work is that there's this cash cliff where you earn, as long as you earn below a certain amount, it's roughly $1,500 now, your benefit remains the same. But if you earn above a certain threshold of that about $1,500 after some assorted other rules that Ramonia's touched on, you face this cash cliff where your benefit goes from whatever it is to zero. And so there's a really strong disincentive to earn above that roughly $1,500 a month. And there's been speculation that that may prevent people from working. They don't want to risk losing their benefits, because if you earn $1,501, then all of a sudden you lose a $1,200 to $1,300 a month check. And so what POD did is it introduced this benefit offset ramp. And you can see that, at a certain threshold, it's a little bit below that. It was around $1,000 a month. That disability benefit payment starts to phase out, where for every $2 of earnings, your benefit goes down by $1. And so in addition to that, there's actually a whole host of other ways of rule provisions that were simplified. The extended period of eligibility, grace period, trial work period, all of that went away. It's now much simpler. And with the goal being that this benefit offset would hopefully increase the incentive for people to work because they're not going to face this cash cliff where all of a sudden you completely lose your benefit check. So what we did in this demonstration through the Social Security Administration is enroll about 10,000 SSDI beneficiaries into the demonstration. I should note only about 2.5% of people who we invited to participate actually enrolled. And so what we ended up with is a group of volunteers that is very work-oriented. About 15% of people earned above that cash cliff threshold at some point in the past 3 years, and that's more than 2.5 times more than the average non-volunteer. And so you have to think about that in the context of trying to generalize the findings. And what we did is for these 10,000 people who enrolled, we randomly assigned about 2/3 of them to a treatment that faced these new rules, that benefit offset, and about 1/3 of them were in the control group that had the current rules. And because of this randomized design, it means that the control group is going to represent what the treatment group might have looked like if they had continued under current rules. And so if we find any difference in outcomes between the two groups, between the treatment and the control, we're going to know that it is because of these different rules that the treatment group faced. And so we're going to look at, did it affect their work, income, benefits over the next 2 years? We looked at a whole bunch of data. I'm going to focus today and just tell you about what we found in the administrative data. And just to give a quick overview, we find that this eliminating the cash cliff, replacing it with the benefit offset, actually had no impact on people's work activity. When you look at the average outcomes for the treatment and the control group, their earnings, employment, income, benefits, those are all pretty much identical between the two groups. And so the key question then is why? And I'll talk about 3 things, but I'm mostly for this webinar and the topic going to focus on the part about administrative burden. As was defined, that was the hassle or challenges that people face when interacting with the government program. And when we think about that here, the big things that are going to show up is that it was difficult for people to understand the rules. And that difficulty may have been exacerbated by overpayments, where I'll define that in a little more detail later. But the idea is that when you work, your benefit goes down, but that doesn't necessarily happen right away. And so you might get paid too much. Now you owe back the Social Security Administration money for work that happened in past months. And it's really hard to then link how does your work activity lead to the change in your benefit payment. That makes it really difficult that makes it that much harder to understand the rules. Second, there was potentially a limited incentive. It actually turns out that for people who were already working a lot, these new rules and introducing that benefit offset ramp would actually be predicted to reduce work activity. That applies to a fairly small percentage of people, but it might be the group that would work the most. And finally, that first point that I said, why don't people work? Well, they have very significant disabilities. There's these systemic and individual barriers to employment, where we saw that over half of people in the control group had no earnings over a period of 2 years, and only 10% were able to earn above about $15,000 annually. And that could also explain why we don't see any impacts. So in more detail, I'm not going to go through try to explain every portion of the rules, but I want to just highlight these current rules include a lot of complex provisions. Ramonia defined a few of them: the trial work period, the extended period of eligibility. There's this grace period that kind of pauses the rules for a few months. And I'll just say I worked on this I've worked on disability policy for at least 5 years before I felt like I actually understood how these rules really worked. Like, it's hard. And so one of the goals of POD, of the Promoting Opportunity Demonstration, was to simplify that and to reduce administrative burden. They took away and eliminated all of those provisions: the TWP, the extended period of eligibility, the grace period. That benefit offset immediately applied to try to link how your work activity was going to translate into your changes in benefit amounts. But the question isn't, did it reduce administrative burden? The question is, did it reduce the administrative burden enough to really have an impact and make it easier for people to work? And so, one thing off the bat is that people, when their earnings were changing, in order for their benefits to potentially change in a timely manner, they need to report their earnings monthly. And that, if they don't do that, that is the potential for these improper payments or overpayments, where you get a benefit check, but it turns out based on your work, you weren't supposed to have gotten quite as much. And so down the road, SSA then docks your benefit check. And so this is kind of the big picture impact findings. What you can see here is that when we looked at earnings, benefit amounts, annual income, those are identical between the control group and the treatment group. And so we see that this demonstration had no effect on those outcomes. There's maybe a small difference when you look at people who have a high amount of earnings, but it's pretty small. And it turns out once you adjust for things like multiple hypothesis testing, that goes away. So I wouldn't draw too much into this part of it. So what we then did is we tried to look at, given that there's no impact, we tried to look at the subgroup impacts. Were there some people who had a positive impact on their earnings or on other outcomes? And so one thing that we did is we split the group by how much were you earning when you enrolled in the demonstration. And so we look at first people who have significant earnings, whose benefit payments were actually suspended when they enrolled in the demonstration, meaning they were earning above the cash cliff amount. Turns out that group is the group where the benefit offset reduces the incentive for them to work. What you can see is that the kind of leftmost bars here, people in the treatment group, their benefit payment went way up because instead of having their benefits continue to be suspended, or a portion of them have their benefits continue to be suspended, that benefit is now reintroduced, but it's just phased out more slowly because they don't face the cash cliff. And so we see that they have much higher disability benefit payments. When we look at the group with modest earnings who had kind of decently high earnings, but were not having their benefits suspended, people who had some earnings versus people who had no earnings, all of them, you can see there's no difference in benefit payments. And when we then do the same thing and look by baseline earnings, again, the difference between control group and treatment group is pretty negligible. In all four of these groups, you can see those bars are equal. There's no statistically significant difference between them. And you can see also the people with the significant earnings are the ones who then go on to keep earning more. People who had no earnings have much lower earnings, over the subsequent 2 years. So we then ask, why was there no impact? And I sort of touched on this. In the interest of time, I'm not going to spend too much time on this slide, but there's the kind of three big stories: administrative burden, learning costs were one thing that came up. And one learning cost, this only went for 2 years. A prior demonstration, the benefit offset national demonstration, they only started to see positive findings in the third year. When we think about that limited incentive, right, we see that there weren't impacts anywhere, even among this group where there was actually less incentive to work. And again, a lot of people had really significant disabilities. 90% agreed it was difficult to work because of a physical or mental condition. What I want to spend the last couple of minutes I have on is this idea of learning costs, and that's the administrative burden piece, and that it was really hard for people to understand the rules. So we asked people in the treatment group, right? The rules changed. There was no longer any trial work period. What percent of people kind of 1 year after they enrolled, 2 years after they enrolled, understood that there was no trial work period? It was about a third of people. So it's very, very low. Most people, when we ask them this question, they just say, I don't know. And even if you ask people in the control group, is there a trial work period? For them, the answer is yes. You see a similar 30 to 40% know that. Very few people understand the termination rules. And the fundamental idea of POD was that if your earnings are above a certain amount, your benefits will be reduced. Fewer than half of people actually understood that. And so it was really hard for people to understand these rules in that they just didn't do it, right? This wasn't asking at what amount did the benefit offset kick in? How much did it reduce by? How much would you have to earn to get to zero? Like that, we could get into more of the nuance. This is just the fundamental premise that if earnings are high, do they understand their benefit can be reduced? Fewer than half of people knew that. And I think a potential reason that made that hard for people who were working is about overpayments. And it's this idea that the beneficiary owes SSA back money because an earlier payment was too high. And this happened very frequently. So among people who used the offset where their benefits were adjusted, 74% of them had an overpayment. And overpayments occurred in about half of the months that people saw their benefits reduced, with that median overpayment of $482. I think it's worth noting that these overpayments are much smaller relative to current rules, because in current rules, if you have an overpayment, by definition, it means that you were paid a full benefit check and then your benefit should have been zero. So you owe back that full benefit check. So the overpayments are very, very large, but they're pretty uncommon because of how rarely people lose their benefits. Here, those overpayments were really frequent. They're happening all the time if you're working. And so they don't necessarily have as much of a fiscal impact on you, but they make it really hard to then understand, how does my work affect those benefit payments? And so just to wrap up, we replaced the cash cliff with a benefit offset. It didn't affect people's work activity. I talked about what the likely reasons are, and I just want to highlight the administrative burden again. A lot of the literature focuses on the ways that these burdens prevent people from participating in programs, about the learning costs, compliance costs, psychological costs. But I think our work fits in with this idea of redemption costs, that these are still people who are getting benefits, but they're maybe not able to engage with it in the most effective way. There are some people who maybe it would have been better for them to work more, but it's hard for them to understand the rules and to make that decision. And so they're not able to take advantage of and use benefits in the most optimal way. And so one potential solution that people could think about is using new beneficiaries in this type of study, where they don't have to think about what's the change in the rules. They just immediately get placed into a much simpler version of the rules. So thank you so much for listening, and looking forward to chatting in the Q&A.
Thanks so much, Mike and Ramonia and Deb. This has been excellent. We've been trying to cram a lot of information into this webinar. So we have just a couple of minutes left for Q&A. I'm going to jump right in. Hopefully we can get to a couple questions, but I think a lot was already answered with the presentations. Mike, we have learned a lot about the challenges experienced by people. You just presented a lot of information about that yourself. Are there any strategies or efforts that we could use or could be employed to lessen the administrative burden for applicants that might make the application process easier? And how might municipal and state organizations help in these efforts given the current policy situation?
Yeah, so there's a lot of evidence that this application process is tricky, and a lot of the research that I do wasn't what I was talking about today, but is on kids with disabilities. And in particular, if you think about what you need to do to apply for disability benefits for SSI for a child, you need to gather a ton of medical information on every doctor that you visited, what are the dates, all of the medicines that you've been prescribed, a lot of information that might be hard to come by. And if you don't do that accurately, it's going to affect whether or not you potentially get benefits, because the way that SSA determines the disability is they go and contact the doctors and collect the information for themselves that is listed on the application form. And so I've been doing some research specifically with people in the Allegheny County Department of Human Services in Pittsburgh. And what we're trying to do is basically use data to make the application process easier for people. And so what we've done is, first, we actually developed this model to predict who do we think is eligible for SSI, who are kids. I have another paper on that we think there's potentially as many as 50% more kids across the country who might qualify for SSI benefits just based on their healthcare history. And so what we're trying to do is streamline the application process for them. And we were using their healthcare history to predict, are they eligible? But now we just know through Medicaid data what is their healthcare history, and we're going to kind of automatically fill the forms of who are the doctors that you visited, when did you go to the emergency room, what are the medications you've been prescribed, as well as have a 10 or 15-minute phone call with families to basically deliver them this completed form that they can use to then go and apply for benefits. And I think that, my hypothesis is that administrative burden plays a really big role. It is hard to complete this application process. But we're going to do an experiment similar to what we did that I was talking about with this paper to try to, isolate and present evidence that it is about the administrative burden. We're also going to offer people just information, say, you might be eligible, go ahead and apply. And My guess is that won't have as big an effect as actually offering people this application assistance to streamline the application process for them. And so that's something that we're looking forward to doing. And I think it is important for states and municipalities to play a big role here because they know the population, they're working with them like in various ways, like they have access to some of this data. And of course, with the consent of the family that they want to do this, we'll hopefully be able to help them out.
Thanks so much for that. Unfortunately, I do have to cut off the rest of the Q&A due to the fact that we've reached time, but I do feel like we were able to answer a lot of questions within the research presentations and Ramonia's presentation as well. I'm going to post all of the resources from this webinar within a day or two. That includes the recording of the webinar, as well as the slides and the research papers that were presented by Mike and Deb. Thank you so much, Ramonia, Rochester, and Debra Brucker, and Mike Levere, for sharing your time, your experience, and your research with us today on this very valuable and extremely timely topic. And thanks to Dawn Duran for handling the tech part of the webinar today. And thank you so much for all of the folks who joined us in the audience today. Have a great rest of your day. Thank you.